The United Nations set aside June 26 each year to commemorate International Day Against Drug Abuse and Illicit Trafficking. Campaigns, rallies and posters of different designs are put together to create awareness on the dangers associated with drug abuse and illicit trafficking. Society is usually traumatized when drug abusers commit crimes to pay for their drugs, as most criminals who indulge in taking substances now do this for survival. The dangers associated with drug abuse and illicit trafficking are enormous, bordering on unwanted mental and physical effects caused by drugs. During a sensitization campaign at Ilupeju Grammar School, members of the Pharmaceutical Society of Nigeria gave an overview of the dangers associated with taking substance and how government can help people who are already in this shell.
The people that are already in this society, in this shell, society can help them by being empathetic towards them. I mean, show them love, go to them, talk to them, welcome them, and also tell them that, oh, because I've been that drug abusers doesn't mean that they cannot get out of it. It is something that they can get out of and have a future, a bright future, regardless of the situation they are at that particular point in time. So I encourage society to always talk to them, welcome them, try to help them by going to the appropriate avenues, that's going to hospitals or clinics where they can seek help for these patients.
There's a lot the government can do to both to prevent and to help treat cases of substance abuse. So first of all, the government can organize like lots of sensitization campaigns. This is like the basic thing the government should be able to do, like organize campaigns, schools, churches, hospitals, mosques. People need to know like how dangerous this is. Then the government can also provide treatment for people who are already like deep into substance abuse. There are so many places they can seek care, such as the Federal Neuropsychiatric Hospital. So like these are ways government can actually prevent and help to treat substance abuse.
For the first, we are still seeing it around the streets, around the town. It means that the borders are empty, are not being guarded properly. Okay, so what I have to say is that I think the police, the law enforcement agencies should do their work, because some of them, they are being cultivated here, are being moved from one place to another, and they are expected to be searched, to search these people carrying them, concentrate them, withdraw it and get it burnt. That is how it should be done. Drug is bad. Where I work, I see patients that their career, their dream has been shattered because of drugs. Okay, so I advise to everybody, not just youth, everybody, to stay away from drugs. It's not good for you. It's not good for environment. It's not good for your family.
Well, by embracing them, first of all. Embracing them, by doing that, you begin to encourage them to shift away. That's the first. Then the next thing is to take them to an hospital where they give them proper rehabilitation. Because the truth about these drugs is once you've started, to get out of it is gradual. It may take a long time. So they need proper care from the hospital and also parental support. So for the society, you have to embrace them, drag them in, then tell them, encourage them to step out of it. Say no to substance abuse. It's very dangerous. There's no good that comes out of it. There's no betterment. There's no superhuman. Rather, it diminishes everything humanly capable of the person.
Thankfully, in this school, we have not seen students in such, or probably they are pretending, but we have not seen them. When we see them, we isolate them, get them exposed to the counselor. The counselor will explain to them many things, and probably we can even invite our professionals from the Federal Psychiatric Center to come and speak to them, and then we hope with that they can do much in their life for them to change the habits of drug abuse.
They should stay away from drug taking. They should stay clear away, because the aftermath of it is death. Is death, because they may be taking it initially, and they'll be thinking that it makes them high, but at the end, it destroy both the spirit, it destroy the soul and everything, and it tarnish their it tarnish their their goals in life. So my advice that I've been giving them, and I'll still continue to give them, is to stay clear and to have focus so that they'll be able to achieve their goals in life, to steer clear of drugs.
Pupils were also sensitized on the intake of substances which is detrimental to their mental health and performance in school.
It's harm the body, and it's not good to be taking drugs that doctor did not predict for us.
It can lead to like the students, maybe a student have been performing well before. Then when the student start taking drugs, he start losing attention in class, because when he's in class, all his thoughts will be on the drugs he's about to take or he wants to buy, or the money we use to purchase that drugs, and that can lead to loss of attention and can also cause some expulsion from school. Because when he start doing that, he loses many days in school and his grade starts getting down. So it can cause many effects on the students.
The government should be able to see to, most especially our youth. For example, there is lack of employment, there is unemployment, and this effect makes people to get depressed, and they will not be able to find something to do. And if they some drugs makes people high just because they are saying that they are depressed, so they need to go and take drugs. So if government can try to create employment for the people, for the youth especially, and if government try to ban those drugs that are causing people to get high, or they are making people be ineffective in the society, I think that's very good. If government can ban those drugs, that would be very good.
The advocacy is a step in the right direction towards reducing the prevalence of substance intake among youths.